Hello and welcome to your Home Health Aide training course, Module 1. In our previous videos, we explored what home healthcare is and the diverse individuals who benefit from it. Today we're focusing on you, the vital role of the home health aide. Understanding your responsibilities and, just as importantly, your limits of practice, is fundamental to providing safe, effective, and professional care. Your role is central to a patient's well-being and comfort, and you are often the person providing the most direct, personal connection. We're here to equip you with the knowledge to excel in this incredibly rewarding profession. Let's delve into what it truly means to be a home health aide. As a home health aide, your responsibilities are wide-ranging and deeply impactful. You'll be assisting patients with essential daily functions, acting as a crucial link in their care team, and providing much-needed human connection. Let's break down these key responsibilities, focusing on what they mean for your daily actions. One of your primary responsibilities is to assist with activities of daily living, often called ADLs. These are the basic personal care tasks that most of us perform daily without thinking, but which can become challenging for someone recovering from illness, living with a disability, or facing the effects of aging. ADLs include crucial tasks like bathing, dressing, grooming, and feeding. Your goal isn't just to complete the task, but to assist them in a way that promotes their independence, maintains their dignity, and respects their personal routines. This is about enabling, not taking over. For example, imagine you are assisting Mrs. Davies, who has limited mobility due to a recent fall. She struggles to reach her back when bathing. Your role would be to ensure her shower is safe by placing a non-slip mat, setting out her soap and towel within easy reach, and then carefully assisting her with washing her back, always checking water temperature and her comfort level, respecting her privacy throughout. For dressing, you might help her choose comfortable clothes and guide her arms through sleeves, allowing her to do as much as she can. Or, when assisting Mr. Kim with feeding, who might have difficulty swallowing, you'll need to pace his meals, ensure small bites, and observe for any signs of choking, such as coughing or watery eyes. Always encourage him to participate in his mealtime, and allow him to choose what he eats from his approved diet. These actions directly support their quality of life and basic self-care, building trust and comfort. Beyond personal care, you'll also help with instrumental activities of daily living, or IADLs. These are tasks that support independent living within the home and community, contributing to a healthy and safe environment. This includes things like light housekeeping, cooking, and laundry. These services are vital for maintaining a clean, safe, and nurturing environment for the patient, which directly impacts their health and mood. Consider Mr. Green, who uses a walker and finds it difficult to bend over. Your help with light housekeeping might involve wiping down kitchen counters after use, sweeping accessible areas of the floor to prevent trip hazards, or emptying small trash cans from the bedroom or bathroom. The key here is focusing on patient-specific areas. For cooking, you might prepare a simple, nutritious meal following his dietary restrictions, ensuring it's easy for him to eat and safely stored. And with laundry, you might wash and dry a load of his personal clothes, ensuring they are clean and accessible in his dresser, not just left in a basket. Remember, the focus is on light tasks that directly impact the patient's well-being and safety in their immediate living space, not deep cleaning the entire home, or tackling tasks that are not part of the care plan. A highly critical responsibility, perhaps one of the most important, is to observe and report changes in the patient's condition. As an HHA, you are often the eyes and ears of the entire care team, spending the most direct, consistent time with the patient. You'll learn to recognize subtle shifts that others might miss, and your prompt reporting can prevent serious complications. This includes changes in their physical health, like new swelling, a rash, increased pain, or unusual bruising. Changes in their mental state, such as increased confusion, sudden sadness or agitation, or unusual withdrawal, or even changes in their home environment that could pose a new risk. For example, if Mrs. Patel, who usually has a good appetite and is quite alert, suddenly starts refusing meals for 2 consecutive visits and seems unusually lethargic or confused, you wouldn't diagnose her. Instead, your actionable step is to immediately report these specific, factual observations to your supervising nurse or the care coordinator. Detail exactly what you saw and when. This timely, accurate information allows the professional care team, the RN or physician, to assess, intervene quickly, and potentially prevent a more serious health issue, like a urinary tract infection or dehydration. Your keen observation skills are invaluable. Finally, and perhaps one of the most rewarding and impactful aspects of your role, is to provide companionship and emotional support. Many patients receiving home care may feel isolated, lonely, anxious, or even depressed due to their health challenges or limited social interaction. Your presence can significantly brighten their day, reduce feelings of isolation, and improve their overall mental and emotional well-being. This doesn't mean becoming their therapist, but rather being a genuinely kind, empathetic, and present individual. For instance, imagine Mr. Harrison, who recently lost his spouse and spends most of his days alone, often just watching television. Beyond helping him with his physical needs, you might engage him in conversation about his interests, ask about his day, read a portion of his favorite book aloud, or simply sit with him while he listens to music. Your actionable approach here is active listening, offering a warm and encouraging demeanor, and creating a comfortable, safe space for conversation. You might notice he perks up when talking about his grandchildren, or that he enjoys listening to certain types of music. Sharing a genuine smile, a thoughtful word, or just being a steady, reliable, and consistent presence can dramatically reduce a patient's feelings of loneliness, foster trust, and provide immense emotional comfort. You truly become a trusted and valued part of their life, impacting their spirit as much as their physical well-being. While your responsibilities are significant and broad, it's equally, if not more important, to understand the limits of your practice. Knowing what you cannot do as an HHA is absolutely crucial for patient safety, legal compliance, and maintaining professional boundaries. You are a vital part of a larger healthcare team, and certain tasks are strictly reserved for licensed medical professionals. Adhering to these limits protects both the patient and you. First and foremost, as a home health aide, you cannot diagnose or prescribe any medical conditions or treatments. This means you should never interpret symptoms for a patient, tell them what illness they might have, or advise them on specific medications to take or stop taking. For example, if a patient complains of a sharp pain in their leg, you would never say, "That sounds like sciatica, maybe you should take an anti-inflammatory." Your actionable role is strictly to listen to their complaint, objectively observe any related physical signs, like swelling or limping, document these factual observations clearly, and then immediately report them to your supervising nurse. Diagnosis and prescribing medication are complex medical acts requiring extensive training, licensure, and a medical assessment that HHAs are not qualified to perform. Second, regarding medications, this is a critical area. You may only administer medications if you have received specific, advanced training, and if it is explicitly permitted by your state's laws and your agency's policies. In the vast majority of cases for HHAs across the United States, direct medication administration, like giving a pill, injection, or applying a patch, is not allowed. Your typical role is limited to reminding patients when it's time for their medication, helping them access it, like opening a bottle, or documenting whether they took it. Never physically give the medication, adjust doses, or make decisions about medication. Always clarify your agency's precise rules and specific state regulations on medication assistance, as these can vary. When in doubt, always ask your supervising nurse. Second, regarding medications, this is a critical area. You may only administer medications if you have received specific, advanced training, and if it is explicitly permitted by your state's laws and your agency's policies. In the vast majority of cases for HHAs across the United States, direct medication administration, like giving a pill, injection, or applying a patch, is not allowed. Your typical role is limited to reminding patients when it's time for their medication, helping them access it, like opening a bottle, or documenting whether they took it. Never physically give the medication, adjust doses, or make decisions about medication. Always clarify your agency's precise rules and specific state regulations on medication assistance, as these can vary. When in doubt, always ask your supervising nurse. Finally, and this underpins all your practice, you must always follow your agency's specific rules, policies, and procedures, and strictly adhere to the registered nurse's (RN's) direction. The RN develops the patient's comprehensive care plan and provides you with precise instructions for your tasks. Your care plan is your guide. If you are ever unsure about how to perform a task, if a patient asks you to do something outside of your training, the care plan, or your scope of practice, your actionable step is to never guess, attempt it without clear instruction, or comply without authorization. Instead, you must immediately contact and ask your supervising nurse for clarification or guidance. Your strict adherence to these guidelines ensures patient safety, upholds professional standards, and protects you legally. To summarize, the role of the home health aide is multifaceted, incredibly important, and built on both hands-on care and keen observation. You're responsible for assisting with ADLs like bathing and dressing, supporting IADLs such as light housekeeping and meal preparation, diligently observing and reporting any changes in a patient's condition, and providing invaluable companionship and emotional support. Equally vital is understanding your limits of practice. You cannot diagnose or prescribe, and medication administration is only permissible under very specific training and state laws. Always follow your agency's rules and the RN's direction, as your care plan is your guide. Your commitment to these responsibilities and boundaries ensures safe, compassionate, and truly effective care for every patient. Thank you for choosing this essential and rewarding career path. We'll continue building on this foundation in our next training session.